My name is Dr. Rahul Mukherjee. I'm a consultant cardiologist and electrophysiologist here at Sussex Premier Health. I wanted to talk to you about palpitations, missed beats, skipped beats. So a lot of patients experience a thump in the chest, a missed beat, a skipped beat, and worry about what these symptoms might mean. And sometimes this is due to ectopic heartbeats or extra heartbeats, which is very common, and a lot of people might experience this. So what are these ectopic heartbeats? So an ectopic heartbeat is an extra beat that comes in earlier than a normal heartbeat. So the heart is normally meant to beat in synchrony, the upper chambers of the heart beat first, followed by the lower chambers of the heart. But sometimes you can get an extra beat that comes in at the wrong time, and if it comes from the bottom chambers of the heart, it's called a ventricular ectopic. So what happens is that the heart pumps, and then it's meant to rest and fill with blood, but in that time when it's meant to be resting, an extra beat comes in earlier and causes an ectopic beat. The way a patient might experience this is a thump in the chest, whereby they get a sensation that feels like palpitations, an awareness of the heartbeat, a strong heartbeat, and this may be followed by a pause afterwards before the next heartbeat comes in. Now, is this something to worry about? Well, most of the time, this is a benign problem, but there are some instances where it might suggest other types of heart disease. So if you've had a previous heart attack, if you are known to have underlying heart disease, if you have a blackout, then the presence of ectopic heartbeats will need further investigations. So what investigations do we do? So we may do a scan of your heart called an echocardiogram, which is an ultrasound scan, which looks at the structure and function of your heart. We may also do a Holter monitor, which is ECG monitoring of your heart, whereby you may wear a Holter monitor for a number of hours, maybe 24 hours or 48 hours, sometimes longer, and we see how often you might be having these extra beats. If the extra beats are happening 1, 2, 3% of the time, this is generally reassuring. If it's happening 5, 10, 15% or more, then this may need treatment. And that can be with tablets or it can be with procedures, a procedure called an ablation procedure. Generally speaking, most people who have ectopic heartbeats, it is a benign problem and there is no underlying structural heart disease. It's usually related to an irritability in the heart muscle. There are certain things that can make ectopic heartbeats worse: stress, anxiety, being dehydrated, lack of sleep, an illness, fever. So it may be that there are lifestyle modifications or other changes that you can make to reduce the symptoms associated with ectopic heartbeats. But the important message is that if you do feel these extra heartbeats, there is something that can be done about it. And we would be delighted to see you in clinic to assess this further.